Next community conversation, we're joined by Dr. Patricia Rodriguez-Lozano, Director of UVA Health Women's Heart Care. She's sitting down with Aaron.
Dr. Rodriguez-Lozano, it's so good to see you again.
So good to see you too.
Thank you so much. So today we're talking about kind of two things, women's heart health and then the Women's Heart Symposium coming up in November. But first, let's talk about heart disease. How does that differ in women versus men?
Thank you for that question. So important that women, we are not little men, even though for decades, I think everything we knew about heart disease was about men, and we forget that women, we have differences in our anatomy, differences in our physiology, and also we present in a different way. Many times we do not have disease in our main coronary arteries, but the little arteries of the heart, what we call microvascular disease. So when we get tested, our testing will come negative and they will tell us, oh, you don't have anything in your heart. And that is not always true. Okay. And that is extremely important. Also, our risk factors can be different. So in women, we have to think about, for example, our age of menopause. So early menopause increase our risk of cardiovascular disease. When we lose our natural estrogen, we start calcifying, we start developing atherosclerosis. How many times doctor will ask us, when was the age of your menopause? Our complications during pregnancies, hypertensive disorders of pregnancy, gestational diabetes, all that increase our risk factors.
Wow, I did not know that. That is something that women should know.
Yes.
So thank you for that. And are there different heart disease symptoms that women should look out for?
Yes, it's important to understand that women, when they present with heart disease, they might have subtle symptoms. They also have chest tightness, but they might have other symptoms associated together with chest tightness that can distract us and also the healthcare providers that take care of us. For example, we can present with shortness of breath, fatigue for many months before we actually have our cardiac event. We can also have gastrointestinal symptoms like nausea, and then that might delay our diagnosis and our treatment.
Okay. And then let's talk about the Women's Heart Symposium coming up on November 1st, correct?
So we are very excited about that. That's going to be on Saturday, November the 1st. It's our first symposium, the Women's Cardiovascular Symposium. And we have a fabulous agenda. We have many external speakers, like 10 speakers, and also beside our UVA faculty. And it's going to be a celebration, I think, of everything that we have done in the Women's Heart Program since 2022. And we also will have some patients' testimonials also to talk about their experience and the care that we have given them in the Women's Heart Care Program. So we invite the community, the providers, to come to our symposium again Saturday, November the 1st.
All right, that sounds like a wonderful event and a great time to recognize all the work that you all have done in advancing women's heart health. So thank you so much, Dr. Rodriguez-Lozano. It was great seeing you again.
Yeah, and we are matching.
Yes, we are. We always are. We'll see if we do it again next time. Steve, over to you.